There are a lot of reasons that we do chemical peels in the dermatology office, and today I'm actually going to take you through a live chemical peel demonstration with a patient of mine who consented to be on video today. And we're going to talk about the reasons that we do chemical peels and what are the pros, the cons, the risks, the benefits, everything that you need to know about chemical peels. So hopefully you'll be more educated on them and understand if it could be good for you in your situation. Now, I do want to say thank you to those that watched the channel. This patient primarily wanted to consent to filming because he had learned through social media on the content that I put out, and that means the world to me that somebody found value in that, and I hope that you find value in this and in some of the other content that I produce. So on the chemical peel today, we're using trichloroacetic acid at 35%. This is a medium depth chemical peel. So there's certainly stronger chemical peels, but there's a lot, some that you can even do at home that are gonna be a lot less intense than this. So the trichloroacetic acid is a modified version of vinegar. Acetic acid is just vinegar, but this makes it much stronger, more acidic, and it breaks up the keratin proteins in your skin cells. So they lose connection with each other and they will start to slough off and peel in 3 to 7 days. When that happens, you're left with fresh skin underneath, and hopefully all of the skin that peels off is that sun-damaged skin, skin that might have precancerous or even sometimes early skin cancer lesions could be treated with a chemical peel. And this patient has had a history of actinic keratoses or precancers and even some skin cancers, and so we're trying to get ahead of that to prevent them from needing more aggressive treatments in the future. In this particular encounter, you can see that the patient is using nitrous oxide. This is just to help enhance their comfort, and we did do topical numbing beforehand. So we're really trying to make the patient comfortable, but to be honest, it's still pretty spicy at times. And the patient did get through it. This kind of crescendos and decrescendos, so the pain kind of gets really intense and then starts to trail off. And after about 20 minutes, people are very comfortable and just kind of feel like a mild sunburn. There's a number of reasons we do chemical peels in the office. They can be a great anti-aging tool to resurface the skin, to take care of age spots, fine lines, and wrinkles. And another reason is to help treat the skin in individuals who have had a history of precancerous skin lesions or skin cancers. And that is what we're going to be doing today, is treating an individual who's consented to be on camera today with a 35% TCA chemical peel. This is going to help to resurface the skin and reduce or hopefully eliminate the number of precancers on the skin and the number of skin cancers they may develop in the future. So we have prepped the skin by putting on topical numbing cream for about 45 minutes. And we're also providing the patient with nitrous just to help keep them really comfortable, because even with topical numbing, a chemical peel can still be really spicy. All right, so we're going to start the chemical peel with a little Vaseline to help protect around the eyes, because we do not want to get any of this in the eyes. And our patient has generously consented to the filming today. So we're going to start here on the forehead, and we're doing both the face and the scalp today. And we just apply this in layers, and we don't see the skin change immediately, but you'll notice as we go, the skin is going to begin to frost. That's the phenomenon that we call it, named after a dermatologist, Dr. Rubin. So he first described the Rubin level 1, 2, and 3 frost, depending on how much confluent whiteness we see on the skin. A chemical peel is something you have to be careful with in darker skin types because it can lead to pigmentary problems. In more fair-skinned individuals, we typically don't have a big problem with that. So taking really good care not to get a large amount that's gonna drip and run somewhere that we don't want it to be. And give us a thumbs up when it starts getting spicy. Yep, he's feeling it on the forehead. So right here we'd have kind of like a Rubin level 1 frost. You know, we see it kind of patchy, but it's not confluent white change to the skin. But we'll get there. And here we use kind of a rough woven gauze to help exfoliate a little bit as we do the peel. And then once we get to the end point where we want, we'll cool the patient down with cool towels. So we're getting to a Rubin level 2 frost now. And we are going to go for a Rubin 3 frost. Just keep breathing. Nice gentle breaths in and out with that nitrous. So we're starting to get to a Rubin level 3 frost in areas where you see more confluent white color to the skin. You're doing good. It's coming along really nicely. We're just a couple minutes away from being done. Best we can. Our patient did absolutely great with this. I know they got pretty uncomfortable during the procedure, but we do whatever we can to get them comfortable and cool their skin down quickly after the procedure. And I am super excited to eventually share the results with you guys on what his skin looked like before. Of course, you see the immediately after peel, and then what happens to the skin when it heals in like 4 weeks. Really, the skin's healed in about 7 to 9 days, but sometimes the little redness may persist, and we'll see the final result fully healed, no inflammation, about a month from now. So this particular chemical peel is one of my favorites for precancerous spots and sun damage on the skin, but it does help with fine lines and wrinkles. It helps with sunspots, and it can really just help to give an overall more even and tight complexion of the skin. But there's more specific peels that focus just on fine lines and wrinkles. Some will do more on the pigmentation front, and some help a little bit more with acne, just depending on the ingredients that we use. So definitely let me know what kind of questions you might have about chemical peels. I'll do my best to answer them down in the comments, and maybe we follow this up with additional videos. Certainly I'm going to come back and show you guys the before and after of my patient. Now, if you're sticking around, I greatly appreciate that. I appreciate your support on the channel, because my ultimate mission is to go and provide as much free dermatology care as possible. So it means the world to me when you like, share, and comment on the video. And if you want to help support the work that we do, go ahead and check out the links down in the video description. If you're shopping skincare or other things, if you buy it through those links, it helps support the channel. You get something out of it, generally at a discount, and it helps financially to support the free dermatology work that we want to do. And we are going out and doing that as often as possible. So thank you so much for being here. I look forward to your questions, and I'll see you guys on the next video.